Today I am going to discuss about cervical rib. Basically, in this video we are discuss about the physiotherapy management of the cervical rib in detail. Basically, the cervical rib is an accessory rib arising from the seventh cervical vertebra. Rarely, it is rise from sixth and fifth cervical vertebra. Incidence, it is present in 0.4%, and nearly 50% of these are unilateral. The most frequently, it is seen in on a right side. So, developmental factor which contribute to develop the cervical rib is the in the embryo nerve larger than the rib interfere the development of the costal process. So when the brachial plexus is prefixed, the well develops fourth cervical root and the small second thoracic root offer a little resistance to the costal process at the seventh cervical root. In postfix, brachial plexus well developed first thoracic root offer a resistance to the costal process of seventh cervical root. Obviously, the cervical rib is more common in the prefix variety. Next, when we talk about type of cervical rib, there are four varieties are described. Number one is complete. The cervical rib reach up to the first thoracic rib. Second is bulbous end. In the cervical rib it has a bulbous end. Third is uh, tapering end in the cervical rib tapers, and fourth is the fibrous bend. In this, the rib is presented by the thick fibrous bend. And there is another classification. There are four type of cervical rib. Number one, type 1 is the complete rib that articulate with the first rib or the manubrium. Number type 2, incomplete rib which with the free distal tip. uh, Type 3, incomplete rib with the distal fibrous band attached. Type 4, the short piece of bone extend beyond the cervical 7 transfer process. So what is the pathological anatomy of the cervical rib? The neurovascular structure, brachial plexus, subclavian vessels are hung up by the cervical rib that is inserted into the second tubercle of the first rib space. Second one is pronounced dropping of the shoulder in women after the middle age, trauma and unusual lifting operation, acute illness, and make the muscle weakness and pulling the plexus and artery distally give rise to the septum. So the what are the associated conditions condition in the cervical rib? Association in the cervical rib are the thoracic outlet syndrome due to compression of the lower trunk of the brachial plexus or the subclavian vessel. Number two are the compression of the brachial plexus may be identified by the weakness of the muscle around the muscle in the hand, and the compression of the subclavian artery is often diagnosed, and the compression of the sympathetic chain may cause the Horner syndrome. So next one is the what are the symptoms when anyone have a cervical rib. So there is a three type of symptom. Number one is so there are four type of symptom. Number one is the local symptom, the tender supraclavicular lymph which is bony hard and the fixed when palpated. Second is sensory symptom, a tingling in the hand, finger, confined other to the radial side or ulnar side of, or sometimes involve even whole hand. Next, pain which radiate down to the arm. Third one is a vascular symptom, cold, clumsy extremity, particularly the fingers. The skin color change to blue associated with the tropic change. There is a rare risk of gangrene. Radial plexus become feeble and may even absent. So next one is the motor symptom. What are the motor symptom? Loss of hand grip, tendency of dropping the thing from the hand, and the wasting of the palmar muscles. So what are the clinical features of the cervical ribs? There are when the cervical rib is arise, anyone have a cervical rib, the cervical rib with the local symptoms show a presence of the lymph and tenderness in the supraclavicular fossa. Cervical rib with the vascular complication give rise to a pain in the upper limb. Temperature and the color change. Radial plexus is visible or absent, and the feeling of numbness is present. So cervical rib with the nerve pressure symptom. The nerve pressure symptom is due to the angulation of the first thoracic nerve root. The patient complain of paresthesia along with the medial aspect of the arm, hand, and the little finger. There is a weakness of the hand muscle also. So how we can diagnose it? Through the radiograph. Plain X-ray of the neck or anterior posterior AP view help to identify the cervical rib, whether unilateral or bilateral. However, the presence of the cervical rib shadow do not rule out the possibility a rib as a fibrous band are not usually visible in X-ray. So there is a special test for detect this cervical rib. There is a adhesion test, spurling test, and the shoulder abduction test. In the shoulder abduction, it is this is a physiotherapist or orthopedics test. It is used to diagnose the cervical nerve root injury or the cervical disc herniation. It is performed to having the patient abduct their shoulder and the place their hand on the top of the hand, and passive test will involve to decrease the radiculopathy or pain. What is the differential diagnosis of the cervical rib? Cervical rib, basically there are a lot of differential diagnosis. Number one is herniated cervical disc. Number two, cervical spondylosis. Number three, peripheral neuropathy. Number four, Raynaud disease. Number five, syringomyelia, polio, muscular dystrophy, and the motor nerve disease. So next one is what is the management of the cervical rib? There is a medical management, surgical management, and the physiotherapy management. Medical management, the doctor can prescribe anti-inflammatory drug, analgesic. Then the surgical management in a severe cases, the splenectomy, resection of the splenic anterior muscle may be required, and the successful in 70% of the cases. In troublesome cases, remove the cervical rib or the first rib surgically with the periosteum to prevent the regeneration in advocate. Remove it, the complete resection of the rib and the division of the splenic group of muscle, resection of the cervical rib for the thoracic outlet syndrome. So what is the physiotherapy management? There is on the basis of symptom. The regime is a plan for pain relief. The thermotherapy for pain relief and relaxation. Shortwave diathermy is used but it is contraindicated in case of sensory impairment. To improve the distal circulation, the gripping exercise can be prescribed. For specific exercise such as self-restricted scapular elevation and adduction can be used. Self-resisted strengthening exercise of the shoulder elevation, abduction, adduction muscles can be performed. A progressive resistance exercise with weight belt for the shoulder girdle muscle can be used for the cervical rib, and the exercise for the active arm, especially hand, are advises. Endurance exercises like as progressive resistance exercises. The strengthening exercises of the whole arm to improve the tone, power, and endurance. Posture correction can be advised. The progressive resistance exercise for shoulder girdle muscles. That's all.